Hello. Gynecomastia surgery is one of the most common procedures we perform at the Venkat Center. And the most common question our patients ask us is, Doctor, what are the scars like after this surgery? Are the scars very big? Are they very noticeable? I'm Dr Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore. And today we will talk about scarring after gynecomastia surgery. So let us begin by talking about what is gynecomastia. Gynecomastia is basically an overgrowth of breast tissue in men. Men also have glandular tissue in the chest like women, but they don't normally grow. If there's any hormone imbalance, if male hormones come down or female hormones go up and there's an imbalance, then they get stimulated and grow. The most common reason for this is during puberty. Another very common reason is people who take steroids when they go to the gym. Now unfortunately, the thing is, even if those hormones normalize after puberty, this glands stay, it does not go away. And because it's glandular tissue, not fat, it cannot be burned away in the gym. That's why it requires surgery. If you require surgery, obviously it's going to be a cut on the skin that's going to leave a mark. Which is why the question comes, what is the mark after gynecomastia surgery? Now, before we understand the marks for a gynecomastia surgery, we need to know what the grades of gynecomastia are, because the marks depend on this. There are basically 4 grades. Grade 1 is mild gynecomastia, wherein there's just a little bit of glandular tissue. Usually it's just around the nipple. Grade 2 is more gynecomastia. It is moderate, but there's not much skin excess. There is tissue in a larger area, but there's not too much extra skin. Grade 3 is moderate with extra skin. So you have tissue everywhere and there is some amount of extra skin. And grade 4 is severe gynecomastia, wherein the chest almost has a feminine appearance, like a female breast. Now, obviously, we can see here that the milder the gynecomastia, the easier the procedure. So, the basic reason why scars happen in gynecomastia surgery is the mismatch between skin and glands. You can remove the glands by liposuction. So, in the procedure, what we do is we make holes and we suck out the fat, that is known as liposuction. But what about the skin? So if there's a lot of extra skin, removing that skin is what can leave a scar. Another thing that we do during surgery is glandular extraction, which is where we remove the glands near the nipple. This is another reason why scarring might happen in a gynecomastia surgery. How is gynecomastia surgery done? In most places it's done under general anesthesia. Our specialty is we do it under local anesthesia. We only give anesthesia to the chest. You are awake during the surgery. The reason we do it this way is it makes the surgery very, very safe. There are no risks of general anesthesia. Secondly, we can make you stand up during the surgery, see how it's looking, make you lie down, do some more, so the result can be better. You pick a date, you come get it done, go home the same day. There's no admission or anything. There's a bandage around your chest and you need to come for 2 days to get the dressing changed. Now, let us look at the scarring after the gynecomastia surgery. So before we talk about what we do at the Venkat Center, let us look at what some of the most common scars are. Like I said, here there's a difference between early and late gynecomastia. In early gynecomastia, what a lot of people do is they make a cut around the nipple like this. It's a semicircular cut that goes halfway around the nipple. They do this to remove the glandular tissue near the nipple. Some people make only a cut in the side of the chest, known as lateral approach. So they make one big cut in the side of the chest, so there's no scar in the front of the chest. Now the issue with these marks are the one near the nipple, it is a semicircle, it can be a little bit visible. And the one in the chest, that also can be a little bit visible, it's less so. But the thing is, you're trying to remove glandular tissue from somewhere far away, you might end up not removing the entire glandular tissue. Also, if all the liposuction is done from only one hole, this might lead to an uneven appearance. Now for more severe gynecomastias, what people do is they remove a lot of skin. So in that case, you have a scar going all the way around the nipple. You might also have a scar running vertically down the nipple or another one in the chest. This depends on how severe the gynecomastia is. But very severe gynecomastia, this might be required. It's also known as a chest lift. Now, having seen all this, what is it that we do at the Venkat Center? What we do is we make 2 small holes. We make one hole near the nipple that's just a few millimeters. We make one more small hole in the armpit. Both of these are around anywhere from 5 to 7 millimeters. So through these 2 small holes, we do all our procedure. The advantage of this is we can get a better liposuction through 2 holes. It's a more even liposuction, and both the holes are small, neither hole is visible. The one near the nipple heals very well, the one in the armpit looks like a small mole. So having 2 unnoticeable scars is better than having 1 noticeable scar. After all, this surgery is done so that men can be bare-chested at temples, at swimming pools, and if there's a large mark instead of the gynecomastia, that hardly serves the purpose. So you might ask, how is it that we are able to do this? There are basically 2 reasons for this. One is, near the nipple, we remove all the glands in pieces by a piecemeal technique rather than trying to take the entire gland off in one shot. This is why we're able to do it through a smaller incision than most other people. The other big reason is that we use non-surgical skin tightening devices. We have a device called BodyTite. So what BodyTite does is, there's a probe that goes under the skin. It passes radio frequency energy from inside to the outside of the skin. This helps shrink the skin. This is very important in severe gynecomastia, grade 3 and 4, because in these patients, if you just remove fat and gland and don't do anything for the skin, there's going to be some amount of saggy skin. So in many other places, they remove the skin in the first surgery, but that leaves a mark. So what we do is, we do the inward BodyTite, which shrinks the skin. This works very, very well. In around 90% of patients, the skin shrinks very well and no further procedures required. However, in around 10% of individuals, the skin might not shrink fully. Usually, these patients are heavy smokers or have some other comorbidities. So what happens when the skin doesn't shrink fully? Then we wait for 3 months to see the full result of the BodyTite. After 3 months, if we still feel there's some saggy skin, we might take out some more skin at that point of time. The advantage of doing it in this kind of staged manner is that we are giving a chance for the skin to shrink as much as possible, and at the second procedure, we usually end up taking less skin than you would have if we had done it in the first stage. So this is the advantage of following this. 80% of individuals don't require any skin removal. A small percentage of individuals might require a skin removal, but it won't be a major one. So here you can see an example of the scars after gynecomastia surgery. You can see one hole over here that just looks like a small mole. This gentleman has a mole over here. The scar looks like a mole over there. Secondly, the one near the nipple is tiny and it is hardly made out. So you can see how the marks are hardly visible. And this gentleman who had severe gynecomastia, we have not done any skin removal. Through just these 2 small holes, we've been able to achieve excellent skin retraction, and there's nothing further required. Now, what is the recovery after surgery like? Like I said, you need to come for 2 days to get the bandage changed. After that, you can resume work. You can start mild workouts after 1 week, and you can be back to your full workout within a month. The full result of the surgery takes around 3 months. Let us look at some results of this procedure. So here you can see this is a very muscular individual. He made the mistake of taking steroids in the gym. Never use steroids. There are plenty of good reasons not to take steroids. Gynecomastia is one more. So the important thing in him was to make sure that we kept his muscular definition and that we did not make it look unnaturally flat or even inward, what is known as a saucer deformity. This is where being able to make the patient stand up during the surgery is very, very helpful. Here's another gentleman. Here you can see it is asymmetric. In a lot of individuals, it won't be equal on both sides. He has mild on one side, he has severe on the other. So we did the procedure and you can see excellent skin retraction. So much extra skin has all shrunk and contracted. This little bit of wrinkling and bruising that is normal in the early post-op period. This photo was taken like a week after surgery and it completely settles down within 3 months. Here's another individual with grade 2 gynecomastia, complete skin retraction. Another one with grade 3 gynecomastia. You can see a significant amount of extra skin has all shrunk very nicely and there are no visible scars. I hope this video was useful to you in helping you understand what the scars after gynecomastia are like. If you have any other suggestions for videos, do let us know. If you would like to know more about the procedure, do contact us. Our information will be on the screen shortly. Thank you. Have a great day.